is an organization of the United States government that is focused on development. It's one of the largest international development agencies in the world, and we are very proud to partner here in Ghana. We've actually been working together in Ghana since 1957, so even preceding our 60th anniversary, and we're very pleased to partner.
Very well. Well, so that is over 60 years of existence, presence in Ghana as well.
Yes.
Now, before independence, how long had the USAID been in existence, and what were some of the activities? Because I'm realizing that now we are counting a 60th anniversary. But was there a time you decided to, okay, let's officially begin at this point, maybe after independence in Ghana? Or what was the situation?
Sure. In 1957 is U.S. President John F. Kennedy and His Excellency Kwame Nkrumah signed the first cooperation agreement for the United States and Ghana to work together.
Right.
And then in 1961, 60 years ago, the United States Agency for International Development initiated our development assistance here in Ghana. And it's interesting, when we started out in those days, we were focused on food assistance and loans and construction, such as the Akosombo Dam. We also had an emphasis on primary health care, such as we helped to construct the reproductive health unit of Kofonoche, teaching hospital, working in good governance across Ghana with communities and families and in economic growth. And we have progressed over time, over these decades. You may be familiar with You Only Live Once, YOLO, the program to help with reproductive health messaging here in Ghana. We just launched our next 5-year strategy that's focused on Ghana's commitment to self-reliance, and Ghana Beyond Aid, that's focused on economic growth and expanding sustainable development across northern Ghana, and also helping to build the systems for quality services in Ghana. So we're really excited about this next chapter.
Okay, so there is a next chapter. That means that we can look forward to some greater development projects in Ghana. But tell us about the 60th anniversary of the USAID in Ghana. Is there a way to, is there a roadmap to the celebration? Perhaps, what does it even signify for us as, two countries in this great union?
Yes, it's really an opportunity for us to reflect back at where we've come from, how Ghana's development has progressed, and how our partnership has progressed over time. I think we have graduated, if you will, from donations to really closer partnerships and an emphasis on self-reliance. It's also post-COVID. I think we are all reflecting on what we've been through and trying to identify which pieces of our learning we need to continue moving on into the future. So it's an important moment for both the U.S. and Ghana in our relationship.
Well, you mentioned development in the health sector, and even mentioned some of the projects that has been done by USAID. But we know that in all of these activities came COVID-19 that brought a halt to, a lot of, bilateral relationships, amongst other developmental projects. How has COVID-19 impacted the USAID, especially in Ghana?
Yes, I think really based on this long-standing partnership that we've had, we were able to respond to COVID-19 immediately. We've helped to support interventions in the immediate term, medium term, if you will, and then as we look into the longer term. Immediately, we helped to support the coordination of the response and helping to educate and provide information, as you're doing here, to help families and communities to stay safe and to know where to access health care, infection prevention and control for healthcare workers so that they can stay safe. We also looked at particularly vulnerable populations, so helping farmers to be able to continue through e-commerce and e-outreach services so to make sure that they can continue to have access to markets, and launched the National Radio Reading Program in Ghana to make sure that students had an opportunity, especially in remote areas, to continue to learn. Some of the exciting things that we're looking at for the longer term is we've done a great deal to help to provide access to vaccines through the COVAX facility,
Yes.
which, as you know, is a mechanism to help support global equity and access to vaccines. So the United States government is the largest contributor to COVAX, and we continue to leverage that support, strengthen Ghana's surveillance and epidemic response, emergency preparedness to prepare for any future epidemics. So there are many ways that we continue to partner with both the Ghanaian government, but also private sector and communities. We helped several local organizations to repurpose, for example, some apparel companies to repurpose to provide supplies for COVID. 2 local organizations, we helped to triple their hand sanitizer production. So really to address the private sector capacity, to address communities, some conflict mitigation and responsiveness to make sure that those things weren't exacerbated by the epidemic, as well as really looking at some of the most vulnerable populations. So across the board, we've had a very close engagement to respond here in Ghana.
Great. So most of the responses in realizing is geared towards COVID-19, alleviating the impact of COVID-19 amongst us, whilst empowering institutions. I know that the USAID does not just focus on COVID-19 as a health area. There are other health areas that you focus on as well. Has the COVID-19 taken the attention from these areas? For instance, awareness creation when it comes to HIV/AIDS, which is also a focus of the USAID. Has COVID-19 taken away the focus on these other areas as well?
Yes, it's an excellent question. Early on in the response, we agreed to make sure that the focus on COVID did not prevent us from continuing essential services.
Right.
And you're right, areas such as malaria prevention and treatment. The rainy seasons and mosquitoes didn't know that COVID existed. So we had to continue those efforts with HIV/AIDS, with maternal and child health to make sure that women could still continue and families could continue to access those services. So we worked hard to make sure and to monitor to make sure that people could access those services safely amidst the pandemic, and that continues to be an area of focus for us.
Well, so much funds being allocated to COVID-19. Is there? I asked the ambassador, is there any hope of getting out of the pandemic any soon? Because I mean, the USAID has researched, has invested, and continues to invest. What do you see to be the future as far as COVID-19 is concerned?
Yes, I think I'm sure the ambassador had a better response.
I'll take yours as well.
But I'm sure, I think for me, really the work that we're doing through COVAX, through vaccines, is very important. As we vaccinate, as flu epidemics or other epidemics have come to pass, the vaccine will continue to play an important role. I'm sure your viewers know we continue to detect new variants, and we have to make sure that we can protect populations against those variants. I also believe that COVID has shed a light on some important systems that need to be strengthened. So by strengthening our surveillance systems and information systems and logistics systems, it will give us opportunities to have impact way beyond COVID in other areas of health. So those are some of the benefits of targeting funds for COVID, but having a much broader impact.
So COVID has opened our eyes to other things that we need to focus on.
Yes.
Interestingly, the USAID doesn't seem to relent or break down, just as some other institutions have relented, especially in progressing because of the impact of COVID-19. Maybe they are not empowered, maybe they're not getting that source of power to push them running. How have you had this running all this while?
Yes, I think, as I said, the U.S. government is a committed, long-standing partner here in Ghana. And when COVID hit, as we have done for other ups and downs throughout these 60 years, our response was to ask, how can we help? How can we partner together? And in the immediate impact, of course, we had to work together very quickly to establish systems. And now we continue to have that open communication to make sure that we are addressing the needs. We have all learned to do things differently. We are still working virtually. We've had to find new ways to continue to keep ourselves motivated. But I think we've learned a lot and we've achieved a lot together.
Well, I believe that as we go on in the fight of COVID-19, there would be other things that our eyes would be open to, so that collaboratively, just as the USAID has done, we would continue in growing, and especially beyond COVID-19. Well, you're still watching AM Ghana here on ADDY Television, and I'm here with Miss Janean. I got it right?
You got it.
Miss Janean Davis. She is the acting mission director for the United States Agency for International Development, USAID. We'll go for a quick turnaround, and when we come back, we'll be veering into some other aspects of the USAID's projects, talking about education and other aspects as well. You don't want to miss this one. Do stay tuned. Well, thank you for staying with us. You're still watching AM Ghana here with me, your humble servant, REGINALD, ADDY. And always, I would remind you that we are in the month of July. We have dedicated this month to the United States of America. And I told you that we'll be having conversations with some important agencies of the United States. And we're having a conversation with the USAID because we have Miss Janean Davis. She is the acting mission director for the United States International Agency for Development, USAID, or United States Agency for International Development. I mix the words, but it makes the same meaning. Well, Miss Davis, how long have you been in Ghana?
I have been in Ghana now for 3 years.
But you've been in other African countries as well. I understand you speak very good Swahili.
Yes. I've actually lived overseas off and on since 1997. And we've had the opportunity to live in many different countries around the continent.
Well, and in all of this, you were working with the USAID?
A mix. I started out as a United States Peace Corps volunteer in Tanzania for 3 years.
I see.
And since then, I've worked for community organizations and international organizations. And then I joined USAID in 2004.
In 2004. All right, and that's been some, well, long years running. Well, now let's go into USAID in Ghana. In terms of education, what has been the impact of USAID in the educational sector in Ghana?
Yes, so education is, particularly basic education, has been a joint priority between the United States and Ghana since the beginning for the past 60 years in this celebration. We have specifically helped Ghana to implement a phonics-based reading program for children across the country. We have helped to print and distribute over 3 million books and teaching materials across the country. A lot of our work is helping communities to hold the education system accountable. So we work with PTAs and families and communities and teachers on training and coaching to provide quality services. And most recently, during the COVID epidemic, we worked with the Ghana Education Service and the Ministry of Education to launch the National Radio Reading Program, which has reached 4.5 million students in remote areas of Ghana in 11 different languages to help to continue that growth. So we are very excited about our partnership in education.
Well, I see that most of the USAID's projects or intervention when it comes to education in Ghana focuses on the rural areas. So at a point, I realized that you were in the northern sector, backing on some projects, also empowering women as well. Maybe we'll get to that aspect. Let's stay on education a bit. Is there a reason why you focus on such rural areas?
Yes, we want to make sure that we can have a sustained development and economic advancement across Ghana. And as you must know, the northern part of the country has some very challenging statistics when it comes to each of the development sectors. So by focusing on the north and helping the north to advance, it will also help to advance Ghana's development overall. We do have education programming across the country, but we definitely are working to strengthen, particularly among girls, as you noted, in remote areas to help them to improve their learning outcomes.
Well, so are there any other peculiar project apart from provision of textbooks among some of those you have highlighted? Are there peculiar challenges that you perhaps target and decide to ameliorate as a result of your projects?
Yes, in the education sector, as well as many of the sectors, we found that there's a need to focus on helping to strengthen systems for quality and for accountability.
Right.
In many parts of Ghana, where schools exist and teachers are present, we want to make sure that we maintain that accountability to learning outcomes and to educational outcomes. So our emphasis has been around quality and accountability in the sector.
Well, so in the project, let's go back to 2020, last year. You targeted reaching a total of 3 million students. Were you able to reach this, and how feasible or otherwise was it for you?
Yes, we were able to reach that number of students. And again, we want to make sure that while we set those targets, it is not just counting the numbers, but really making sure that we emphasize quality and that we look at impact and the learning outcomes of those students. In the end, as a development organization, USAID does not just want to say the numbers reached. We want to be able to capture the numbers who have improved their reading outcomes and learning outcomes and basic skills.
So when you measure the outcomes of these projects, how satisfactory would you say these have been?
I think we've seen some real progress, especially in reading, but we fully acknowledge that COVID has had a great impact, and it will take us some time to recover from that impact as well.
Well, that has COVID actually perhaps within these times halted the operations in terms of, like, just as I said before, that the focus has been on COVID-19. Has it affected perhaps your intervention in terms of education as well? Or perhaps you still have projects ongoing?
Yes, we have continued projects ongoing to help with learning outcomes and really to support community interventions. We paused on some of the face-to-face interaction as we needed to, but we were able to utilize technology and radio and other means to allow those programs to continue throughout the pandemic.
Well, in the classrooms for the kids, one of those intermediate areas that the USAID has focused on so far is reading.
Yes.
And mathematics. Why these peculiar areas?
Yes, we have a focus on basic primary education, on phonics within reading, on math, to provide that foundation for students to achieve later in life. And we work with the students, but importantly, we also work with the teachers and the school administrators, as well as the parents and communities, because we believe that reinforcing those skills requires more than just the student themselves.
Well, so still on education, many students, especially when we get to the secondary school, what we hear about is the exchange program that students normally embark on, going out of the country and then bringing in. But in reality, we're in COVID-19 times. What is the way forward when it comes to embarking on exchange programs, and what are some of the projects or perhaps the plans to carry on with exchange programs in terms of education?
Yes, so the U.S. government has multiple different opportunities for international exchange. Even during COVID, we shifted some of those to be virtual. We created some virtual communities of practice so that people around the world could learn together and problem solve together. I think now we are monitoring the pandemic closely to know when it's safe to reinstitute that international travel and experience. But in the meantime, we're making the most of technology that we can to continue that learning.
All right. Now, in Ghana, I want to share a problem with you.
Okay.
All right. In our country, education, that is primary education, is dominated by the private sector. Now, this is as opposed to the United States. I don't know if it's the same from New Jersey, where you hail from. But I have learned that in the United States, it's mostly the government that provides the greater number for primary education. Now, how do we achieve the empowerment and all of the interventions with the kind of system that we have here, where the basic education is dominated by the private sector?
It's a great question, and we just completed an assessment of low-cost private schools across northern Ghana. So we sent our team out to ask very similar questions of what are some of the benefits, what are some of the opportunities of these schools being private. In some cases, there's increased accountability with the community for some of the private schools. But we are at the point now of collecting that information so that we can identify interventions that address and engage the private sector as well as public sector schools. USAID has worked very closely with Ministry of Education and Ghana Education Service, as well as private schools, to advance these outcomes.
Well, so you were part of the Peace Corps in Tanzania. I know that Ghana has also benefited a lot from the Peace Corps training, but just as Her Excellency, the Ambassador, told me, she says that currently there is a halt on the Peace Corps training. How are we handling this? Because these Peace Corps beneficiaries come into the country to help in education as well. There is a gap created now. How do we fill that gap?
Yes, it's interesting. As I felt as a Peace Corps volunteer, many of the volunteers who were here in Ghana had already made Ghana home. And so it was very challenging for them to leave their communities to return to the United States. So we're working very closely with the government of Ghana to help to facilitate the return of those volunteers. So again, our priority is to make sure that everything we do maintains safety for everyone involved, but I think we are really looking forward to their return.
Okay, well, now let's go back to, you mentioned accountability as one of those areas or those achievements that you hope to get to. How do you intend to strengthen accountability in the areas of education, especially?
Sure. I think, and it's interesting that for us, accountability is a cross-cutting theme across sectors. The idea that Ghana has many strategies and policies and plans, but we want to make sure that we are focusing on implementing those plans and monitoring to make sure that they are accountable. So in the education sector, that means engaging families and communities and district assemblies to make sure that teachers are showing up and providing quality instruction. In governance, it means working with local communities, town halls and Durbers, and to make sure that the targets we've set are monitored and kept. In the health sector as well, it means making sure that health providers provide high standards of quality care and that we are following up. So for USAID, accountability runs across all of the sectors in which we work.
Well, okay, I think we would wrap up on education right here. And it's still the USA month here at ADDY Television. Great conversations by far. So you know what the USAID has been up to in terms of education in Ghana. I'll go for a quick turnaround. When we come back, we'll dive into some other sectors that the USAID has been focusing on so far here in Ghana. Do stay tuned.
Thank you.
Well, thank you for staying with us. You're still watching AM Ghana here on ADDY Television. Well, great discussion by far. Ms. Janean Davis, the acting mission director for USAID, has been telling me so much, and I believe that you have learned a lot already. Well, we're speaking on education, but now let's go into other sectors. You're welcome back from that break.
Thank you so much.
Well, I'm enjoying the conversation, I must admit, and your smile is also quite infectious. Well, so now let's go into the USAID. Obviously, it's a big institution, and we cannot just say that the focus is just on education and COVID-19. Certainly, there are other aspects, other sectors that the USAID focuses on. Can you share those other aspects with us?
Sure, happy to. And thank you again for this opportunity. USAID has 3 overall cross-cutting objectives in Ghana. So the first is to strengthen economic growth and broad-based economic growth.
Okay.
And the second is to strengthen the systems for quality services in Ghana. And the third is to accelerate the sustainable development in northern Ghana. And we do that, those 3 objectives, through working, in addition to education, which we've discussed, in the health sector. It's very broadly defined. We work in nutrition and water sanitation and hygiene and family planning, malaria prevention and treatment, HIV/AIDS prevention and treatment, system strengthening. We also work in energy, trying to focus on giving access to electricity, efficient electricity for Ghanaians. We work in the agriculture sector. And we also have very important work in governance and democracy.
Well, seems that you work everywhere. Now, amongst these, which is typical or topical for the USAID?
Yes, I think all of these areas really have such a contribution to development. And that is why we worked in each of the areas to contribute to each other. I think right now, with Ghana's focus on self-reliance and economic recovery through Ghana Cares and other alleviation programs, we've prioritized interventions to help with economic recovery whilst continuing to build and strengthen institutions and systems for the longer term.
Well, I'm happy you mentioned longer term. That we've seen where we are now, and 60 years on with the USAID, we're here. At least we've seen some development in terms of health and all the other aspects that you have mentioned. And going to the future, the long term, what are some of the interventions that we are bound to see? What are some of the projects, the implementations that we are bound to see as a country, or perhaps as two countries?
Sure. Part of our partnership, if we take the example of economic growth, we are really looking to help micro, small, medium enterprises and organizations in Ghana to increase access to the local market, but also the region as a regional hub and international markets. So really making, creating more opportunities for access for smallholder farmers to be able to improve. We focus on maize, rice, soya, but really creating opportunities for them to expand. As I mentioned in the example of the energy sector, really focusing on fiscal responsibility to help to make that sector more efficient. So I think while we do our immediate interventions with each of the grants we give through interventions like our business challenge portfolio that we co-fund with the Danish government, we're doing the immediate interventions thinking with the long term in mind of what strategic opportunities those interventions will create.
All right. Now, it's very, it sounds easy peasy, the interventions and the progress and the achievements chalked by the USA, but we can't say that all of this come devoid of challenges. What are some of the challenges that you face as an institution trying to strengthen other institutions?
Yes, I think all of us have one of the main approaches that we use within the USAID, we call it a behavioral approach. So we actually start out by identifying the challenges. What are the roadblocks that are preventing us from achieving these goals? We've been working for 6 decades together in Ghana. And where are some of those areas where we still haven't achieved the progress we want? And then we take a moment to look at the data and ask ourselves why, and what needs to change to be able to make that progress. And from that discussion, that's where we came out with these cross-cutting themes of sustainable development and accountability and strengthening systems as key interventions that are needed to unlock some of those challenges. The other piece I'll add is really making sure that we address all levels, that we're not just working at the national level with government institutions, but that we also engage communities and families as part of the response. That can be challenging, but often has the biggest payoff and impact.
So in all of your projects, you work with everybody across every sector, ensuring that you impact to the maximum that you expect to. Well, we wish the USAID and yourself the very best. Let me say a big thank you for honoring this invitation and granting us this interview. For you, I just want to say something in Ghana. Oh, you are done. Ake opa. Do it on in the oba. I know it's long, you wouldn't understand, but what I'm
Thank
saying
you.
is we're grateful that you honored our invitation and you came in. If you can teach me something in Swahili, I'll be grateful as well, because I just taught you Ghana.
Asante sana.
Asante sana.
Thank you very much.
All right, so Asante Sana. It sounds like something else here in Ghana, but it's fine. I've been having a great conversation by far on the USAID, and helping me was the acting mission director for the United States Agency for International Development, USAID, Miss Janean Davis, and I got it right once again. We're very grateful. My name is REGINALD, ADDY, and this has been AM Ghana. This is the USA month, the month of July, and we'll bring you some more conversations here at ADDY Television, where we bring good things to life. Thanks for watching. We have some more segments coming up, but do stay tuned.